Aloha everyone, and thank you for joining the COVID-19 Public Health Action webinar, Transformation of Higher Education During COVID-19. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, we just have some Zoom housekeeping to go over. For all questions, please utilize the chat box or question and answers box located at the bottom of your screen. We will not be offering continuing education credits for our COVID webinar series. And lastly, all webinars are being recorded and will be available on the Hawaii Public Health Training Hui's YouTube channel. It's my honor to introduce you to our guest speakers for today. Our first speaker will be Dr. Jayne Smitten. Dr. Smiton is an Associate Dean and Professor at Hawaii Pacific University, College of Health and Society, and has served in various academic roles for 5 university systems, some in affiliation with leading healthcare authorities in Canada, the Middle East, and the US. In her current role at HPU, Dr. Smitten has been exposed to and is helping to facilitate the preparatory requirements for safety, security, and logistics of the students and teaching faculty for fall 2020. Our second speaker today will be Dr. Perkle. Dr. Perkle is an associate professor and specialization head of health policy and management in the Office of Public Health Studies at the University of Hawaii at Manoa. Much of her research is classified as life course epidemiology, in which she investigates determinants of health and well-being across different human developmental periods, such as childhood and adolescence. Dr. Perkle often examines how critical life events, such as childbirth, influence health outcomes decades later, and has done so in a wide variety of global settings from Brazil to Colombia to the US and Canada. In addition, Dr. Perkle is co-principal investigator of the Healthy Hawaii Initiative Evaluation Team, which provides technical assistance and program evaluation support to the Hawaii Department of Health. And last but not least, our third speaker will be Lynn Talana. Angel is a current graduate student at UH Manoa, achieving her Master's of Public Health, specializing in social and behavioral health sciences. Her field of interest focused on social determinants of health, especially in Filipino communities. She is currently working on her student practicum with Dr. Perkle, where Angel and her colleagues created a needs assessment survey focusing on university students' needs and concerns surrounding the COVID-19 pandemic. She is also a student volunteer as a part of the Hawaii Emergency Management Agency, State Emergency Support Function 8, Community Care Outreach Unit, analyzing community needs in light of the pandemic. Now, it is my honor to welcome Dr. Jayne Smitten as our first speaker. And Dr. Smitten will be sharing how the university has conducted a comprehensive analysis and approach for the safety and security of the faculty, staff, and students at HPU.
Aloha, everyone, and thank you also for the opportunity to talk with you about this important time of what we're dealing with in our case, HPU readiness and navigating the COVID impact challenges that we're dealing with. With this invasion of the pandemic, it's really affecting our university, and a lot of thought has resulted in our actions and in preparation for our HPU safety and security, and of course, all for faculty, staff, students, visitors, any of our stakeholders. So the actions I'm going to talk about today were really based on government regulations and industry best standards. And foundationally, the CDC has provided the guidance, and we've got adherence to as well to regional and local and state mandates, resulting in a really comprehensive approach for the policies and procedures that we're doing here at HPU. So really, I'm going to be highlighting 3 areas: sanitation, distancing, and screening. And if we have time to touch on some of the pedagogical challenges that we have here with our faculty and COVID, what's going on with the COVID scene. So for starters, in regards to sanitation, we've established some safety assessment standards, and we've got signage here everywhere. It's definitely impacted our environment, and our mask situation. All of us are mandated to have masks indoors and outdoors on the premises. I've taken mine off right now, but when I came in here, I had it on. So, and PPE, of course, where it's required. We've had engineers looking at our filtration, air, and ventilation systems, and there's been modifications on that as an example. And so therefore we've had increasing outside airflow into facilities in the areas that we are going to be using for teaching and learning. We've had regular communication and updates, obviously, from our provost and president. And this is really important as far as the informational campaigns, to make sure that we're all on the same page and we're all receiving the same information. So that has continued consistently, I'm sure, as all centers are dealing with this navigation. We have a phosphate-free electrostatic spray fog that's really been cool. It's an application that protects our surroundings for 90 days. And inevitably, when this fogging finishes, we'll have about 3,000 or 300,000 square feet of disinfectant covering all of the HPU areas. So that will help with the cleaning and dealing with the COVID virus. But we still have surface cleaning disinfectant procedures for all areas. And then the areas that are high traffic and touch areas like the doorknobs and restrooms and fountains, anything used by the students and staff and faculty, those also we've made sure that we have cleaning procedures in place. So, you know, in the sanitation or the sanitization area, we've certainly upped it to the standards of something I haven't seen before in a university facility. And it's very remarkable what we're going to have to continue probably to deal with too. So I'm curious to hear more of the questions we'll have in relation to the other facilities as well. For our social and physical distancing, the workplaces and classroom spaces have been really reviewed, and we've got distancing happening in each of the areas. So classrooms are mapped out. We've got the 6 feet distancing between the actual classroom desk areas. In our clinical training and simulation centers, we've also established guidelines, and we still have, and you know, with the changes as we deal with them, we have to of course have some changes in the numbers in our classroom settings. Elevators have signs for maximum. As soon as you get off the elevator to get onto our floor, for example, you have the actual directionals for what we need to do for screening, and I'll get into that in a moment. But we've even had consideration of outdoor classroom spacing and seating. In our ATM or Aloha Tower Marketplace classrooms, we've actually got a very picturesque outdoor setting for one of the classrooms that's really quite novel if you think about it, because we've got the ocean background in some of our classroom settings. So it's pretty cool, and outdoor as well. The Pier 9 cafeteria by Sam Choi also has all the indoor setting removed, for example, and we have an expansion of the outdoor settings. So that's again having an outdoor and more open air, fresh air kind of an approach. And we have had staggering of workplace environmental setups as far as teleworking at times. And again, we'll have to reassess and look at this as we go along. So that's one of the areas that probably will continue to have some modifications. Finally, the screening component is we've had comprehensive safety protocols, and one of the things that we've done is we have daily COVID screening questionnaires for all of our students, staff, and faculty, and these are available on an app or else on their HPU portals. So it's easy access, drop-down menu of the specific questions. So it's you know, user-friendly. So that makes it a lot more doable, if you will, and not as much problem with having to complete those. And in addition to that, we have daily thermal scanning that happens in about 15 areas all over the campus. So these are done through photo ID and facial recognition of the students and faculty. And it's a pretty novel opportunity to see yourself and actually get your temperature taken as you go to work. And in addition to that, that has a badge process, so you can also have clearance with COVID with the temperature scanning for visitors on campus as well. So they've really put a lot of thought and effort in thinking about all these things that we need to do on a day-to-day operations a complex university facility. As far as off-campus too, arrangements have been made for quarantine procedures, and we've got HPU training plans for actually 25 members of our organization in HPU for internal contact tracing protocols. And this is based too probably on it is on a pooled testing kind of approach, where we've got a one-of-a-kind developed of a proposal development by CHS and the University Advancement Group, and it's currently being investigating with FDA-approved labs as to how we'll approach this. But stay tuned on that. It's a very novel approach on pooled testing for a university organization. I just wanted to mention too, I just made a couple of notes here just to make sure that I address it and probably elicit some questions. We've had very stringent requirements for our out-of-state students that have come back, and they have to have symptom-free attestation, so that we have a strict quarantine of 14 days if they were not unable, or if the students were unable to be tested within 72 hours prior to arrival. And when they arrive, the transportation arrangement, everything has been thought of about going to their dorms or to their hotels. And when they are in their little education cohorts, or student cohorts, if you will, they have daily wellness check-ins, HPU check-ins, and these calls are for just checking up on the students, and they basically are staying where they are unless they have to go, if they've been approved as far as the quarantine attestation, or they had to go see someone for medical reasons. So in saying that, we have a set up facilities team here at HPU that's headed by safety and security, and really is on top of what we're doing if there's anything that comes up in relation to requirement of isolation and rooms for any particular COVID positive or COVID symptom situation. We also ensured that we had pre-semester testing of all our front staff, operational staff that were dealing with the students that did come in. So well positioned in being prepared for this. And it certainly does take a lot of, as was mentioned in the beginning, just a lot of thought and deep thinking about what's required by all the different areas of safety, security, IT, all the faculty and student arrangements. So as we move forward, obviously we're going to be having to monitor and look at all the logistics, and making sure too that we have support for our pedagogical changes with COVID. And that will entail looking at not only online, virtual, and face-to-face, but really focusing on, for our university, we're focused on the whole idea of experiential. So we want to have as much of an experiential approach of whatever we do for our students here. So I've addressed many essential measures, and that's the sanitation, the distancing, the screening, the workplace environment, and these are all critical, of course, for everyone here in fall in getting participation and up and running. And so we really had to think about addressing these essentials and deep dive into thinking about the reimagination of what we need to do in our teaching and learning areas, the pedagogy and the effects of what happens with these kinds of situations in the classroom bubbles. It's all towards, again, maintaining the effective experiential approach that we're known for here at HPU. So now it really is just up to us, our HPU Ohana and communities, to really support the rules and guidelines with Aloha, Pono, and Kuleana. And that's what we're really going to keep working towards. So in saying that, look forward to the questions.
Mahalo, Dr. Smitten, for sharing that information with us. So next we will have Dr. Perkle, and she will be discussing some of the changes at UH, including providing some context on why the Office of Public Health Studies made changes to their practicum. And she will also be sharing some information on the needs assessment that surveyed food security and insecurity for their students. So welcome, Dr. Perkle.
Great, thank you so much for having us, for having myself, and then also my student Angel, who you'll meet very shortly. I'm really pleased to be here, and I'm certainly very flattered to have been invited. So what I'm hoping to do in my portion of the presentation is to talk a little bit about the background or context behind a number of activities that we engaged in the Office of Public Health Studies in order to support our students. I would say that what you'll get from my discussion and that of Angel is a little bit more of a micro look at some of the efforts that we've been engaging in, as well as the impacts on our students in a relatively small department. So before we get into what we did, which is what Angel will talk about, I'm going to tell you a little bit about why we did it. So I'm going to take us all the way back to mid-spring when we started to really recognize that there was a crisis happening, that there was a pandemic, and that we were going to have to inevitably put in place restrictions in order to slow spread of the virus. So if you think back to what happened in March, it became quite clear right before the spring break that classes were going to have to shift to an online environment. And at that point in time, even before any of that happened, we already knew that our students were in precarious situations. So if you look at the students in Office of Public Health Studies, like many other students who are on the UHM or on the University of Hawaii campuses, we have a really diverse student body. Our students come from all walks of life, but a large proportion of them are first generation. They come from immigrant families. They're immigrants themselves. Many of them will work multiple jobs to make ends meet. And many are paying their way through school. Some of them have families. Some of them have children. So in addition, as with most universities, a lot of our students do work on campus, but a lot of them also work in the service sector. So many of our students support themselves in jobs in the restaurant industry, in bars, and in retail. And as we know, these are some of the industries that have been the most impacted by the measures we've put in place to control the virus. So as I alluded to already, is that, if we think back all the way back to spring, we already knew before any of this happened that a lot of our students were already experiencing precarious economic situations. So we mentioned earlier food security. So I'm going to use the example of food security. Would it be possible, Maka, to put up the slide? So for over a decade, it's been clear that university students on the University of Hawaii campus are at elevated risk of food insecurity. There was a study that came out in 2009, so over 10 years ago, that showed that 21% of UH students were food insecure and another 24% were at risk of food insecurity. So that's close to the 50%, right? And those who identified themselves as Hawaiian, as Pacific Islanders, Filipinos, or mixed race were at even higher risk of food insecurity. So here, what I did is I asked I asked to put up a slide of our own work. So this is work that we did last year for the Department of Health. It was using Hawaii Behavioral Risk Factor Surveillance Survey results, where we have information about food insecurity across a representative sample of Hawaii. And what you can see is that, unfortunately, we were not able to disaggregate the students from the homemakers, but in that category that we still have elevated rates of food insecurity in our population. So we know that students are at high risk of food insecurity. So why am I going on about this? Why am I telling you about food insecurity? This is because it's a term, first of all, that's thrown around a lot. It's something that we hear in the media a lot. And what it represents is an inability to access food and sufficient amounts of food in a socially acceptable ways. And it's one of the worst consequences of being low income. And it's one of the most visible consequences of being low income. But there are also consequences of importance that are associated with being food insecure. And those are mental health concerns, including anxiety, depression, mood disorders, as well as diet-related chronic conditions such as diabetes. So why does this matter in this current moment? Well, all of these things are sort of coming to a head together. We know that the virus control measures are negatively affecting food insecurity across the state, and that it is quite likely that our students are at high risk of being one of those groups that are disproportionately impacted by food insecurity. We see how extreme food insecurity is in the state every time there's a food distribution event. We also know, and this will be talked about a little bit more when we present the results of some of our needs assessment, that mental health issues are a major concern amongst students. And this is, as I mentioned earlier, something that's associated with food insecurity. So we expect aggravations of food insecurity amongst our students, and we also know that mental health is a concern that's linked with it. And then just to kind of sum everything up and bring everything together, we also know, based on work that's done at the national scale, that those people who are in the service sector specifically are at highest risk of experiencing food insecurity because of the COVID restrictions. And so our students, they kind of check all those boxes. So we, as I mentioned, and the reason I'm giving this very long prelude is that when we went into this outbreak, we already had reason to be concerned about our students. But it's not just the economic ramifications and the economic consequences that we're concerned about with regards to the COVID control measures for our students. We're also really concerned about their psychosocial well-being. You know, academic life is really stressful for many people. It doesn't matter how good of a student you are or not, it can be stressful. And in particular, for our students who are aged between 18 and 25 years, it also represents a really critical developmental period, and it's full of large transitions in life. So people between the ages of 18 and 25, they're considered to be in late adolescence. There's a lot of physiological changes that are still associated with that age group that are linked to adolescence. So there's a lot of changes happening already that are physiological, but this is also linked to a lot of big life course changes. When you are in that age group, particularly if you're going to university, a lot of university students are leaving home for the first time. They're developing their adult identities. They're forming lasting social networks. These are friendships that are going to last them their whole lives. And for many of our students, they're meeting their life partners during this period. And yet, with our COVID-19 response, we're directly impacting many of these parts of their lives that are so important for their long-term well-being and development. So obviously, we've put in place measures that isolate many of our students, that keep them away from their social networks, and we really have no idea what the long-term impacts of these are going to be. This is such an unprecedented situation. We don't know what the interruptions to this very important part of adult maturation are going to be with regards to the health and well-being of our students. And so I think that we already came into this situation with good reason to be concerned. And so us in OPHS, we're trying to figure out things to do. And we recognize that right now we're in this situation where we won't be able to fix everything, and we're just trying to make a very bad situation tolerable. So I'll just give you a little bit more prelude and kind of a history of how we got to where we are right now. So if you go back to spring, you know that all of us scrambled. As we moved to online courses, both students and faculty alike, it was pandemonium. Essentially, we just tried to make it through. Some of our international students got stranded. We had many students who were on the mainland when we made the transition because around spring breaks, they had to make decisions about whether to come back or not. It was a period that was fraught with a lot of anxiety. But as we kind of got through that initial shock, we started to take some step backs within our department and say, okay, what do we need to do? What do we need to do to make things better as we move forward? Because this isn't going to go away. So it was at that point we started to have conversations with both our students and with other faculty members about what was going on in the immediate environment in which we were working. All of us had these stories of students coming up to us with heartbreaking stories, students that were going to have to leave the state because they could no longer afford to live here, students that were having to move back home, students that were dropping out of school. And so we wanted to figure out what we could do to support our students in the ways that we could. So while our university has absolutely and most certainly put forth resources for our student body, they're not enough necessarily. So I'll give you an example. We have the UH Student Relief Fund. It's a great effort and it's absolutely critical. But a student could only apply a single time, and the maximum amount of money that they could get was $500. Later on, we got the CARES Act, and that's definitely helped quite a bit because now students could apply up to $2,500. But this is going to be a long-term issue, and many people are not going to be able to get back to work, or they're not going to be able to work enough hours. And so we need to have more help, not just financial, but other types of resources. So what we did in OPHS is a number of us got together And we tried to figure out how could we engage our students in part of our response. Public health students, they're service-oriented. They want to do things to help the community. So we needed to find ways to help them. And it was even more complicated because many of our students weren't allowed to do in-person work. So we also had to be creative about how do we engage our students at a moment in which they want to be engaged and in which the need is really elevated, and do something that was meaningful for our community. So I worked together with Lisa Keel, and I supervise the practicums of 2 students. One student is here today, this is Angel, and I have another wonderful student who's been working on this as well. Her name is Taylor Ronquillo. And as a group and with the support of our leadership, we put together some resource lists that will be introduced to you shortly. And then we also did a needs assessment amongst our students because it became really clear, and again, we'll get into this in more detail, that we were going to be entering our fall semester blind. We really didn't know. There were no systematic efforts to survey students. So we decided, okay, we can't do it at the university, but we can definitely do it within our own student population. Let's figure out what are the most important needs so that if there are ways that we can address them within the department, we'll do it. And if we need to do more advocacy to help them more broadly, we'll do it as well. So I'm going to stop there. I know it was a large prelude, and hopefully you guys will be able to see the fruits of our labor with the next presentation. Thank you.
Thank you, Dr. Perkle. So without further ado, I will turn it over to Angel to share the results from the needs assessment that they did with the university students with their needs and concerns surrounding COVID-19.
Thank you, Stephanie, and thank you, Dr. Perkle, for that introduction and that prelude to what we did for our practicum. So as Dr. Perkle has mentioned, in response to the sudden changes brought by the pandemic, my colleague Taylor Ronquillo and I, we focused our practicum on providing resources and volunteer opportunities to students. Many students have been affected by this pandemic, yet in the beginning there was a lack of connecting students to the resources that they need. In addition, many students have had their education plans suddenly changed. For example, as a part of the public health program, students are required to dedicate time to an organization or research project related to public health as a part of their practicum or applied learning experience, or APLE. However, as a result of the pandemic, many students have had their original plans thwarted and were left frantically searching for opportunities to complete education requirements. As a part of my practicum with Dr. Perkle and with the help of HIPHI and the Hawaii Youth Service Network, we've gathered information about available resources and consolidated it all into one resource guide, which was then disseminated to students and faculty as well as into the community. So this is just a screenshot of the resources that we provided for students, and a couple of examples of resources that we provided were financial support services, parent and keiki support services, food support services, just to name a few. And then as you can see, it's an extensive list of resources that can be available for students and also for the community as well. Next slide, please. So to address the practicum and APLE needs that our public health students need, my colleague Taylor has reached out to organizations across the state to find volunteer opportunities for students so that way they can complete their education requirements, such as like practicum and APLE. Next slide, please. So as we got further into the summer and closer to the fall semester with no signs of the pandemic slowing down, we had concerns about the students' current and future safety and well-being. This led to Taylor and I conducting a needs assessment survey to better understand students' needs and how OPHS can better support their students. Taylor and I are students ourselves, and we thought it would be best to gather the data on the well-being of our student population, how the pandemic has personally affected them, and what type of support do students expect from the university. So a voluntary survey was sent out to all undergraduate and graduate public health students. This survey was a mixed methods consisting both of short answer and close-ended questions. So one question asked students what are their top 3 resources that they currently need, and most students indicated financial support as their most needed resource, followed by mental health services, then food support. Next slide, please. A follow-up question asked about the challenges students will expect during the fall 2020 semester. And 76% of students were concerned about the financial challenges, such as tuition and wages. 72% of students also listed risk of exposure as COVID-19 as a concern, and then 49% of students were concerned about mental health challenges. Next slide, please. So the survey also assessed the students' current state of mental health. One question asked how often students felt tense, worried, or anxious since the stay-at-home orders. Over 50% of students expressed a high amount of anxiety during the pandemic. 8% of students responded all of the time, and 47% responded often or very often. 15% responded rarely or never. So, like the favorite part of this survey, or my favorite part of this survey, was actually the open-ended questions. So students were asked open-ended questions regarding how the COVID-19 pandemic has affected their daily lives. What support would students like to see from the university for the upcoming fall 2020 semester, and any other concerns students may have surrounding the pandemic. From these responses, 3 recurring themes were identified, and recommendations were made to the OPHS Leadership Committee based on these responses. So the most common thematic concern among students were financial concerns, such as tuition and employment. Many students have expressed loss of employment, whether they themselves have lost their jobs or their family members have lost their jobs, or they can't seem to find any new employment opportunities due to current restrictions. They also had concerns about paying student fees despite classes being converted to online, and students being unable to utilize campus resources such as the recreational center. The second thematic theme that we identified was fall 2020. Many students had concerns about their college education during the pandemic, stating that they had difficulties with distance learning, yet they also had safety concerns with when classes were to start during the fall. And then the third area in which students have been most affected is basic needs such as healthcare, food, and other basic necessities. So based on these responses, Taylor and I have presented recommendations to the OPHS Leadership Committee. The first one being more advocacy for increased financial support, whether it's to provide more graduate assistant positions, or employment opportunities, or providing more grants and scholarships for students to apply for. And also, we asked that we can start a petition for changes in tuition and fees. If we were to keep student fees the same, then we asked that we can allocate a portion of those student fees to fund for food drives throughout the semester for students. As Dr. Perkle has presented, college students are at an elevated risk for food insecurity, and this was highlighted as a concern in our survey as well. So providing funds for basic necessities such as food should be a priority for students. The second recommendation that we made was that professors should allow some time for mental health check-ins for students, being proactive and reaching out to students to check on their health and well-being. As we saw from the survey results, mental health is a major concern among our public health students. Students are anxious about the ambiguity of our current situation, and with limited in-person social interactions, it may be difficult for students to reach out. So we ask that faculty can take that necessary step to reach out to students as much as possible and check in on how they are doing. The third recommendation would be to have professors be more transparent about expectations and empathize with students during this stressful time. Many students have expressed difficulties about learning from home. It's difficult for students to find a personal space to concentrate and study at home, especially if they live in multi-generational households, which most families in Hawaii do. Therefore, it's imperative that professors show empathy towards their students and have realistic expectations on how classes should be run. Communication is important, especially during these times where things can change in the course of a matter of days. It is easy for students to be lost with new information coming out every day, so we ask that faculty effectively communicate with the students, whether it's through daily updates during class or emails from the dean or director. The fourth recommendation would be to have PPE and visual safety precautions in place. Now, this recommendation was made with the idea that classes were going to be in person or hybridized. However, this is no longer the case. If I'm not mistaken, UH is pushing for online classes, but we still recommend that faculty start preparing now in the event that classes do start to transition to in-person classes. So having hand sanitizer dispensers readily available in class, masks for people who forget their own mask or lose their own mask, signs for social distancing, and markers for 6 feet apart throughout the campus. And then we also recommend that OPHS continues to provide resources to students through the resource guide. The resource guide will be provided to public health students online through their course pages on Laulima, as well as through our OPHS website, so that students may have easy access to these resources. And then we hope that this resource guide can be updated regularly through the fall semester so that students can be connected to the necessary resources. So I hope that these findings from our survey can shed some light on what challenges and concerns college students have during this pandemic. And I think it's very important that universities should take students' perspectives into consideration as we move forward into the new school year. Thank you.
Thank you so much, Angel, for sharing your wonderful research that you did. So I do want to remind all of our attendees to please put any questions that you might have into the chat box or into the questions and answers box. I do want to let the attendees know that if we do get any questions on the other University of Hawaii campuses outside of the Manoa campus, they may not be able to be answered by our speakers today, but we will do our best to get answers to you. So our first question can be for maybe both universities. So how are your universities dealing with students who don't have access to distance learning?
They're asking about distance learning, having access to.
Yes, so if a student is who doesn't have access to it, so if they don't have a computer or maybe don't have Wi-Fi, so it would be much more difficult for them not being able to access campus for resources like that.
Right, that's a darn good question. One of the things that we could probably be looking at is what is available for resources within our actual university facilities and learning resources, and seeing if there's any possibility of having sign out of specific resources for them to use. The Wi-Fi itself, well, that's another issue, and it would be mandated that regardless, we always have to think about the safety and health of our ohana. All universities would be looking at that as the highest priority. So we'd have to address maybe potential ideas and putting on our thinking caps of where they can get the Wi-Fi close to their areas.
Yeah, I would reiterate much of what was just said. I think the issue around Wi-Fi is almost a broader structural issue that goes beyond what the universities can address. Like, this is a state issue about assuring that all of our communities have access to this basic infrastructure. And it's not just with universities that we're facing issues, right? We're asking our students to move into an online environment, but this is the same issue with telemedicine as well, that if we don't have good internet connections, it also hampers not only people's ability to get educated, but their ability to receive medical care. I know that University of Hawaii, we have just recently received an email saying that they're doing a rental program, but I don't know much details about that.
Thank you. Our second question is, do you know if there's neighbor island students who are choosing to stay home and doing classes from home rather than coming to Oahu to stay in a dorm?
Yes, we definitely know that that's happening.
That is the same response from HPU, and we're looking at this on case-by-case basis and looking at what the requirements are. The whole idea is being flexible and accommodating, especially during this particular time.
Thank you. Our next question is, in the light of so many universities going virtual versus in person, including all of the other universities on Oahu, even in the past few days, does HPU realistically think that their classes will remain in person for the semester?
Again, I can't reiterate the fact that it's, it's the health and safety is our highest priority. So it would have to be revisiting depending on the COVID numbers, looking at what we have this week. For example, we've got the orientation week and we do have in-person events happening. And with our social distancing, our distancing criterias, our sanitization, our screening procedures, I mean, there's no reason why it can't be happening at this time. But again, with the numbers going up, it's always a concern, and it's something that we'll have to keep monitoring and see what we need to do for the future.
Thank you. Our next question, so it sounds like the University of Hawaii will be doing everything online. Will there be any cases where classes will have to be held in person? And if so, will the classes have smaller sizes than normal? And are the classes going to be offered, the ones that are online, will they be offered through Zoom?
It's a big question, and there's a very complicated, long answer to it. And then I don't, in any way, shape, or form, want to suggest that I'm the expert, because the guidelines have been hard for even faculty to keep track of. But yeah, so currently the guidance is to move as many classes as possible online if they can be. There are courses that have to be offered in person or that are best offered in person. So my understanding is that for things like that have labs or that might be studio classes, is they are trying to see if they can work it out. With regard to the social distancing in large classes, one of the biggest challenges has been trying to find the class space, the physical space. So a lot of our classes, if you had a bigger class, you've either had to find a larger classroom, or there has been talks about restricting the number of students that are able to go into the class. It's a little bit complicated because there are other options. Sometimes you can have 2 different sections in a class. So there's a ton of contingencies. So that's why I said the answer is a little bit complicated, and I don't want to propose to be an expert on it, but yes to many of the points that were being raised.
Dr. Smitten, do you want to address how HPU is handling in-person classes? Have they scaled down the size of the classes?
Yes, we've again trying to do the accommodation and looking at the guidelines for distancing. And we're fortunate here that we don't have the huge classes, so it's more of a smaller class setting. And in saying that, you still have to do the adjustments related to if you're doing a combination of virtual and in person. And so we've really amped up the exposure too for our faculty of what's available for support and resources. But I mean, you can't learn this overnight. It's something that takes time, and there's a lot of individual, you have to have your own inspiration too to become someone who's going to be doing a hybrid kind of approach. So, and we've got the areas of Zoom and Teams and Blackboard Collaborate, and we're looking at, even today we're having a session on Panopto, and we've got other particular technology cameras that can use a Zoom approach where we do an actual Zoom patient interaction in a pilot setting right now, but it's something that we're going to be looking and exploring for further clinical applications. So it's really a whole new rethinking of teaching for 2020.
Yes, definitely. Next question we have is, will there be any resources for students who didn't do well academically when classes switched to all online courses last spring? And do we know if the resources also exist for the neighbor islands as well?
I'm thinking about what happened in the pivoting in spring for our students, and then we did a lot of the in-person required requirements and hours. So when we switched to online, it wasn't a dramatic change in that sense, but it is, of course, different for students. So I think that's something that would have to be addressed early on by the students if that's the concern for future recourse. And we made a point of ensuring that our faculty let our students know if they're having issues, if they're having concerns, if they needed to have follow-up. And it's the same thing with accommodations, that we do address those needs. I don't know if that entirely answers your question for her own recourse in that situation of at her university, but you would have to check with your administration and with your faculty.
Okay, next question is the campus measures and reorganization of classrooms costing the university money? Are some students able to attend remotely while others are in person? So this is a question for Dr. Smitten.
Well, I'm certain that, you know, we have to acquire different tools and enhancements that will cost the money, but in the end, I'm hoping it's not going to cost lives, and that's the whole idea, again, of the health and safety of our students and faculty and staff. Regarding students being able to attend remotely and others in person, we are doing that combination as we speak, and we are having accommodations sent out, or students sending in their requests if there are special reasons why they want to attend remotely or in person, and we're continuing on with juggling that response, and it's juggling that kind of approach. It's a work in progress. So you mentioned I think the rest, I'm looking at the rest of that question. Are students encouraged to participate in food gardens, food stamps, etc.? Money is not nearly as important as lives. I think that we've got a very active student life center here, and we've got all kinds of resources, and if students require things, in fact, we've even had our own staff here and staff at Student Life doing different kinds of fundraising and different things that are helpful for the students, and making sure that we are trying to address what their needs are too.
Thank you. So this question is for both universities, but maybe we'll start with Dr. Perkle. What are your communication plans to keep families informed about potential cases and adjustments or any disruptions in schedule?
So that's two separate questions. One is about the cases, and then one is about disruptions in schedules. For cases, it's really important from my perspective that happen at the university level and is done with the utmost privacy and respect for the health information. And that is done in collaboration with our Department of Health, because it is really, that there's a lot of information in there and a lot of work that has to be done whenever there's a case. So regards to if there is a case, then that really needs to be managed at a higher level, university, and then as well as Department of Health. With regards to communicating with our students about disruption or other changes, that's a different issue. And I would say that as was highlighted by the work of Angel and Taylor, and I'd really like to hear her perspective on that as well, especially as a student. I think there is an onus on faculty as well as administration to be much more communicative with their students. It has been very challenging over the last 6 months to really navigate the complexity of information that's out there, and oftentimes the changing guidance that happens. And so I do think that it's important to communicate by email and through other ways, right? So email is not always the best way to communicate with our students, and I think Angel can talk a little bit more about that.
Yeah, I would just want to reiterate that communication is definitely very important between student and faculty. It's very difficult to manage emails, especially if students were bombarded with emails every day. So whether it's through updates during our Zoom classes or a specific email that we should look out for, I think that would probably be the best course of action.
Thank you. And Dr. Smitten, did you want to share what HPU's plan or communication plan is to keep families and students informed about cases or any other adjustments?
We've got an ongoing FAQ internally for CHS, for family and staff and students, and also even on our website, COVID required FAQs and common questions that are coming in, similar to what is being addressed here. But I just wanted to mention, I really, Angel, just talking about some of the things you were talking about for the mental health aspect, that is so important, and that is key in coming through in the literature very loud and clear. And it's going to be an area that I'm sure that they're going to do future research on, related to how are faculty and staff dealing with it. And it's a stressful time. There's no getting away from that. So what can we do to help our students?
Thank you. Next question is for Angel. What additional resources and partnerships do you feel the university could benefit from to meet the growing needs of your students?
There's a lot, I have to say. While I was creating the resource guide, specifically for students, I think it's best if we try to find resources that can connect to food security, as Dr. Perkle has emphasized, because in our survey there were a couple of students who were concerned about meeting their basic daily livings, and a lot of students have had their jobs, they've lost their jobs, or their families have lost their jobs, so they're having difficulty trying to manage their financial situation. And hopefully, maybe what I would want to see is have a partnership with with other organizations to find funding for students, so that way it could help them with their financial situation, and provide, to help with housing or food, or even their tuitions, because tuition is definitely a major concern for students as the fall semester is beginning to start. So I think the most important resource that students are concerned about right now is financial support. So I would definitely advocate for the university to find some sort of resource to connect students with some sort of grant or financial support to get them through this pandemic.
Thank you so much. And actually, Angel, the next question is also for you. So as a student, what is your biggest concern for the upcoming semester?
Well, my biggest concern personally will be mental health, because this is a time where we have to make, the most important connections of our lives, whether it's through personal connections or professional connections. It's very difficult to do that in a virtual setting. I prefer to have it in person. It's very vital for us to interact in person and make those necessary connections that will definitely be beneficial to our lives. And without that whole in-person interaction, it can be kind of it can be very easy to just get lost in the whole situation, and it's very easy for students to just be just stuck at home and wondering what to do, and being anxious about school, school as well as our physical and mental health. So I would say the most important thing that that professors or faculties should be concerned about in terms of their students, as well as financial support, but also mental health as well.
Thank you so much. So we just have a few more minutes and wanted to kind of open it up to all three of you with, if you have any last minute thoughts that you want to leave with our attendees.
I just wanted to say what a critical point that Angel just brought up about the professional networks. You know, it's true that especially for our graduating students, whether they're undergraduate or masters or PhDs, that it's really important to develop those networks to take the next step, to get the next job. And this is being interrupted in a very severe way.
Thanks, Dr. Smitten. I'm just thinking, you know, thinking back to what Angel was saying, and it's just really important that we have ways of interacting with the students and with the faculty that are really engaging. And that's probably going to be the key if we do end up doing some of the high flex or the different ways of our reimagining of teaching. So I think that's going to be a critical focus in the fall, and we really do need to support our faculty in that way. So I think that's a critical part of it. But reaching out, we're fortunate, and I'm sure the other universities too, we have incredibly skilled resources for behavioral services, and that is going to be something I'm sure they're going to be on the fast dial as well. But we all have to do our parts in trying to be there for each other, and we're all in this together.
And I just want to add that, you know, this definitely is a difficult and unprecedented time in our lives. But, you know, as the school year is opening back up again, I just hope that universities do take the necessary precautions to protect students' health and their well-being, as well as, you know, taking their professional lives into consideration, making sure that they have all the resources that they need to survive this current time.
Thank you so much for sharing those last minute thoughts. Before we wrap up, I do want to remind the attendees that we will be sharing our resources as well as the PowerPoint slides with all of you in the Mahalo email, so you will have access to the resources shared. I want to send a special thank you out to Dr. Smitten, Dr. Perkle, and Angel for coming on as our guest speakers for today. I want to thank you, our attendees, for joining us. And lastly, I want to thank the HIPHI staff behind the scenes for making sure this webinar runs smoothly. As a reminder, we are now hosting our webinars every other week. So our next webinar will be on Wednesday, September 2nd from 1 to 2 p.m. We will share that topic with you shortly, so please be sure to check your emails. Mahalo again for joining us today. Be safe, be well, and we hope to see you on our next webinar. Aloha.
Aloha. Thank you. Mahalo.